Hello, my friends. I'm Dr. Anna Collins, and today I want to talk with you calmly and clearly about this topic because many people live with it quietly every day, not realizing how much it can affect their comfort, their energy, and the way they move through life. If you are watching this, there is a good chance that blood sugar has been on your mind lately. Maybe it is something you were told at a doctor's visit. Maybe it came up on a lab report that left you feeling uneasy. Or maybe you are caring for someone you love and you want to understand what is happening in their body so you can support them better. Wherever you are starting from, I want you to know that you are not alone and you are not doing anything wrong. Many adults experience changes in blood sugar as the years go by, and it often happens quietly, without dramatic symptoms, until one day it starts to interfere with daily life. I want to speak with you the way I would if you were sitting across from me in a quiet exam room. No rushing, no fear, no pressure, just clear, gentle explanations and practical ideas that many people find supportive over time. This is not about perfection, and it is not about blaming yourself for the past. It is about understanding what is happening in your body right now and learning how small, steady habits can help the body feel more balanced and comfortable. As we get older, our bodies naturally change. Muscles may not respond the same way they once did. Hormones shift. Sleep can become lighter. Stress can feel heavier. All of these things can influence how the body handles sugar in the blood. Blood sugar is simply the amount of glucose circulating in your bloodstream, ready to be used for energy. Your cells need it to function. Your brain needs it. Your muscles need it. The challenge comes when that sugar has difficulty moving from the blood into the cells where it is meant to go. Many people are told they have insulin resistance, prediabetes, or type 2 diabetes, but they are not always given a clear explanation of what those words mean in daily life. Insulin is a hormone that helps move sugar from the blood into the cells. Over time, especially with aging, inactivity, stress, and certain eating patterns, cells may stop responding as easily to insulin. When that happens, sugar stays in the blood longer than it should. Often, you do not feel this right away. You may feel mostly normal. That is why so many people are surprised when they see elevated numbers on a lab report. Even when there are no obvious symptoms, slightly higher blood sugar can quietly influence how you feel day to day. Some people notice they feel more tired than they used to. Others notice brain fog, slower healing, more frequent infections, or changes in vision that come and go. Some notice tingling in the feet or hands, or swelling in the legs by the end of the day. These experiences can be confusing and frustrating, especially when they seem to appear gradually without a clear cause. I want to gently reassure you that the body is not broken. It is responding to years of signals, habits, and stresses. And the body is also very responsive to new, kinder signals. Many people find that when they support their body in simple, consistent ways, blood sugar becomes easier to manage, and they begin to feel more like themselves again. One of the most important things to understand is that managing blood sugar is not only about food. Food matters, of course, but movement, sleep, stress, and daily routines all play a role. This is why so many people feel overwhelmed when they are told to just eat better, without any real guidance or support. Real life is more complex than that, especially when you are juggling family, work, caregiving, and your own health. Let me share something I often tell my patients. Your muscles are one of the largest helpers your body has for handling blood sugar. When muscles move, they naturally use sugar for energy. This does not have to be intense or exhausting. Even gentle movement can encourage sugar to leave the bloodstream and enter the muscles where it can be used. This is one reason many people notice that their blood sugar readings look better on days when they move more, even if the movement is simple. For many adults, especially those over 40 or 50, long periods of sitting have quietly become part of daily life. We sit at meals. We sit in the car. We sit while watching television. The body was not designed to sit for long stretches without movement. When we sit for hours at a time, muscles are not using much sugar, and blood sugar can slowly rise. One supportive habit that many people find helpful is breaking up sitting time with short, gentle movement. This does not mean going to the gym or doing anything that feels intimidating. It can be as simple as standing up, walking around the room, or slowly rising from a chair and sitting back down a few times. These small movements send a message to your muscles to start using sugar again. Over time, these messages add up. Another gentle habit that often helps is paying attention to when you move in relation to meals. After we eat, blood sugar naturally rises as food is digested. This is normal. The goal is not to stop that from happening, but to help the body handle it smoothly. Many people find that a short walk after meals helps their blood sugar settle more comfortably. This walk does not need to be fast or long. Even 10 or 15 minutes at a comfortable pace can make a difference. If walking feels difficult for you, there are other options. You might do light stretching, gentle chair exercises, or simply move your arms and legs while seated. The key is kindness and consistency, not intensity. Your body responds to regular signals that say, it's okay to use this sugar now. Food choices also play a role, and this is where I want to be especially gentle. There is no single perfect way to eat, and there is no need for extreme restriction. Many people do better when meals include a balance of protein, fiber-rich vegetables, and carbohydrates in portions that feel satisfying but not overwhelming. Eating slowly, chewing well, and noticing how your body feels after meals can be surprisingly powerful. Some people find it helpful to start meals with protein, such as eggs, fish, beans, or yogurt, followed by vegetables, and then carbohydrates if they choose to include them. This order can help slow digestion and lead to a steadier rise in blood sugar. This is not a rule you must follow perfectly. It is simply a gentle pattern that many find supportive. Hydration matters too. Even mild dehydration can affect blood sugar and energy levels. Drinking water regularly throughout the day supports circulation, digestion, and overall comfort. Many people confuse thirst with hunger or fatigue, so pausing to sip water can be a small but meaningful act of self-care. Sleep is another piece that is often overlooked. Poor sleep can make it harder for the body to manage blood sugar the next day. Many adults notice that after a night of short or restless sleep, cravings are stronger and energy is lower. Supporting sleep with a regular bedtime, a calm evening routine, and a comfortable sleep environment can quietly support blood sugar balance as well. Stress deserves special attention. Emotional stress, worry, and ongoing tension send signals in the body that can raise blood sugar. This does not mean stress is your fault. Life brings challenges, especially as we care for others and navigate changes. Finding small ways to calm the nervous system can help the body feel safer and more balanced. Slow breathing, gentle stretching, quiet moments in the morning or evening, or even a few minutes of sitting in silence can be helpful. I want to share a story that reflects what many people experience without drama or fear. Imagine a woman in her early 60s. She feels mostly fine, but she notices she is more tired than she used to be. Her feet sometimes feel a little numb in the evenings. Her doctor tells her her blood sugar is higher than ideal. She feels scared at first, then overwhelmed, then unsure where to start. This is a very common experience. Instead of trying to change everything at once, she starts with one habit. After lunch and dinner, she walks slowly around her block for 10 minutes. At first, it feels small. After a few weeks, she notices she has a bit more energy in the afternoon. Her next lab results show a small improvement. That small improvement gives her confidence. She adds another habit, like going to bed a little earlier or adding more vegetables to meals. Over time, these gentle changes add up. This is how real change often happens. Not through fear, but through patience and kindness toward your body. If you have been told you need medication, that can be part of a supportive plan, and there is no shame in that. Medications can be helpful tools. At the same time, daily habits still matter. Lifestyle support works alongside medical care, not instead of it. You are allowed to use every tool available to feel better. I want to pause here and say something important. If you have felt judged or blamed in the past for your blood sugar, I am truly sorry. This is not about willpower or moral failure. It is about biology, environment, and life circumstances. Your body has been doing its best. As we continue, I invite you to stay curious rather than critical. Notice how your body responds to small changes. Notice what feels supportive and what feels stressful. You do not need to compare yourself to anyone else. Your body has its own timeline. Many people ask me how quickly they should expect changes. The honest answer is that everyone is different. Some notice changes in how they feel within days or weeks. Lab numbers may take longer to shift. What matters most is the direction you are heading and how you feel along the way. If you ever feel discouraged, remember that even maintaining where you are is an achievement. Stability is valuable. Improvement often comes in waves, not straight lines. As we come closer to the end of our time together, I want to speak directly to you as a person, not just a patient. You deserve to feel supported. You deserve clear information without fear. You deserve to feel hopeful about your health, even if the path feels uncertain right now. If this conversation has helped you feel a little calmer or more informed, I invite you to gently like this video so I know it reached you. If you would like more calm, supportive health guidance like this, you are very welcome to subscribe to the channel. And if there is someone in your life who might feel comforted by this message, please consider sharing it with them. Sometimes a soft explanation is exactly what someone needs. I would also love to hear from you in the comments, if you feel comfortable. You can share what you are experiencing, what questions you have, or simply say hello. This is a safe, welcoming space, and your voice matters. Thank you for spending this time with me. Be gentle with yourself today. Your body is listening, and every small act of care counts.